Welcome to the Health Bulletin. Today we have some shocking news to share with you. 3 women in the USA have been infected with HIV after getting vampire facials. Yes, you heard that right. Vampire facials gone wrong. At least 3 women were infected at a spa in New Mexico in 2018, according to a CDC report. That said, the cases shed light on new ways the infection can spread. They are believed to be the first ever HIV transmissions related to a cosmetic procedure documented in the US. But what exactly is a vampire facial? And how did the women contract HIV after receiving it? And what can people do to keep themselves safe from infection when getting cosmetic treatments? Here is a breakdown of what we know and what experts recommend. What is a vampire facial? The term is a colloquial one for platelet-rich plasma, or PRP facials. It involves drawing a patient's blood and then separating out platelet-rich plasma from it using a centrifuge. The plasma is then injected back into the face through tiny needle punctures. The procedure is said to help repair the skin's barrier by stimulating the production of new collagen and elastin, which can reduce the appearance of wrinkles and acne scars. The treatment could cost anywhere between $1,000 to $2,000 at a licensed medical spa. But how did the New Mexico women contract HIV? In summer of 2018, the CDC became aware of an American woman, aged between 40 and 50, who tested positive for HIV while she was abroad. The woman reported no history of injection drug use or recent blood transfusions, and did not have recent sexual contact with anyone other than her current partner. She did, however, report getting a vampire facial earlier that year at a spa in New Mexico. A CDC investigation into the spa, which also provided other injection services, including Botox, later revealed that it was unlicensed and that it had multiple unsafe infection control practices. This included unlabeled tubes of blood and medical injectables that were stored in a kitchen fridge next to food, as well as unwrapped syringes scattered in drawers and on counters. Some of the blood vials also showed signs of being reused, and the CDC had identified at least one client who had tested positive for HIV before visiting the spa. The health agency has since tied the spa to 5 cases of HIV, including 4 women who had all received a vampire facial treatment between May and September of 2018, and a man who was romantically linked with one of the women. The late stage of the HIV infections for the man and woman in a relationship indicated they had contracted the disease before the facial, the CDC said. The spa was forced to close in late 2018, and its former owner, 62-year-old Maria de Lourdes Ramos de Ruiz, is serving a 3.5-year prison sentence. But are cosmetic procedures like vampire facials safe? There have been trials that suggest the treatments are effective for some sports injuries, acne, eczema, and other skin conditions. You may have a bit of pain, bruising, and swelling afterwards. These tend to go away within a few days. The biggest risk comes from the way the blood is handled by the facility providing the treatment. Like with the vampire facials, the CDC advises those looking to get Botox injections to research the treatment provider beforehand, and to make sure that the Botox being used is FDA approved and purchased from a reliable source. To wrap things up, it's essential to understand the dangers of vampire facials and the significance of safety in cosmetic treatments. This incident serves as a reminder that beauty should never come at the cost of health. Always prioritize your well-being when considering any beauty procedure. We want to hear from you. What are your thoughts on this alarming issue? Share your opinions in the comments below. And don't forget to subscribe to our channel for more health updates and news. Stay safe and informed.